And good evening, everyone, and welcome to this community conversation event hosted by the County of Marin and Marin Health and Human Services. I'm Lainey Hendricks, Public Information Officer, and I will serve as your moderator this evening. We have a great lineup for you tonight, but before we begin, I want to let you know that Spanish interpretation is available for this event for those that are joining us on Zoom. So at this time, I'm going to ask my colleague Kellen to provide some instructions on how to access Spanish interpretation. Kellen?
Hola, buenas tardes para todos aquellos que nos están acompañando esta tarde. Si ustedes quieren participar o escuchar esta conversación en español, lo que necesitan hacer, si están utilizando su computadora, oprima el botón que dice interpretación y haga clic en el idioma que desea escuchar, por ejemplo, Spanish para español. Si desea solamente escuchar esta conversación en español con la interpretación, a favor de apagar o silenciar el audio original. Si ustedes nos están participando por su celular y desea escuchar esta conversación en español, a favor de entrar en Zoom y busca los controles de la reunión y toque el más, o sea, son tres puntitos. Ahí habrá de tocar Language Interpretation, o sea, interpretación de idioma, y tocar el idioma que desea escuchar, que es Spanish. Muchas gracias.
Thank you, Kellen. I also want to let you know that we are offering live captioning for this event as well. If you are joining us on Zoom, you can access that through the closed caption button at the base of your screen. And if you're watching on Facebook Live, it's already included for you. So now let's get to our program. As I mentioned, we have a dynamic lineup for you. This might be the largest panel that we've had, but we know that you have had a number of questions on vaccines, and we want to be able to deliver that information to you. So we will hear from tonight Dr. Matt Willis, who is Marin County's Public Health Officer. He will be providing a brief update on the end of the shelter in place, stay at home order, that is, and where we are in the blueprint, as well as give an overview of our vaccine response. We will then turn it over to Jason Weber, who is Marin County Fire Chief and is playing an integral role in our vaccine response. We'll then turn it over to Dr. Tyler Evans, who is one of our Deputy Public Health Officers and Branch Chief of Vaccines within our Emergency Operations Center, to dig a little bit deeper about some of our vaccine operations and allocation to different groups in Marin. Then Benita McLaren, Director of Marin Health and Human Services, will join us to talk a little bit more about special considerations that Marin Health and Human Services is taking as we look at our older adult population and other groups as they become eligible for vaccine. And then finally, we're being joined by a lineup of wonderful Kaiser Permanente doctors who are going to address some concerns around the vaccine, especially the new variant that we are hearing about. And the doctors that are joining us this evening is, Dr. Naveen Kumar, who is Physician-in-Chief, as well as Dr. Laura Eberhard, who is the Chief of Intensive Care. We are also joined by Dr. Shilpa Marwa, who is the Chief of Infectious Diseases. And finally, rounding out that panel is Pat Kendall, who is the Medical Group Administrator. And they are all representing Kaiser Permanente San Rafael. So without any further ado, I am going to turn it over to Dr. Matt Willis to get this presentation started. Dr. Willis?
Thank you, Lainey. Good evening, everyone. It's great to be here with you tonight. I think this lineup reflects how we've been tackling this pandemic all along, across agencies, Health and Human Services, Public Health, Emergency Operations Center, Fire, and our hospital partners. So thank you all for joining us on this panel. Our goal tonight is to move relatively quickly through some of the presentation content we have for you, and then allow plenty of time for questions and answers. Next slide, please. So we're really at an interesting and important phase in our pandemic response in Marin County now. We are just coming out of what is the third wave or third surge in our experience. This is our epidemic curve. When we talk about flattening the curve, this is that It's the number of new cases per day by the date that they were tested. You see on the far left there, that first surge in early March. That was when we first initiated the shelter-in-place policy. That surge felt dramatic and large when it occurred. Obviously, it ended up being dwarfed by the surge that we experienced in mid-July through into August. That being primarily, characterized by Latinx residents, essential workers, about 80% of the cases associated with that surge. And then starting around Halloween and through, fueled by Thanksgiving, and then again by Christmas, and then again by New Year's, each of those holidays really seeing a marked and appreciable increase in cases that followed 4 or 5 days later. Our peak looks like it was around January 10th. So we are now looking about 2 weeks of what looks to be reliable and sustained improvement in our case rates. And so we are looking to, out of the plateau and onto the decline of that third surge, which is encouraging and says a lot about the hard work and the sacrifices this community has made to flatten the curve again. Next slide, please. And based on those improvements that have been seen not only in Marin, but across the region and in fact across the state, yesterday, the governor announced the end of the stay-at-home order. That was the order that was put in place in early December based on projected ICU limitations, reduced ICU capacity. We moved from the 4 tiers, the purple tiers, red, yellow, orange, and purple, to a new category, which was a stay-at-home order based on limited ICU capacity. And we in Marin County had ICU capacity between 5 to 15% for the better part of the latter part of December into January. And that's now improving in Marin as it is across the state with reductions in cases. In Marin County, our case rates are 40 cases per 100,000 per residents per day now, comparison to 105 cases on average at the state. So we're less than half of the state numbers, despite the fact that we are still in deep purple and the virus is very active in our community. Our percent positivity is 5.3% in Marin compared to 15.2% of those who are tested are infected across the state. So about a third of the percent positivity. We also have testing rates that are about twice the state average. So our reduced rates are not because we are testing less, we're in fact testing more. So we're confident that we're ascertaining cases where they're occurring. Next slide, please. So this is what this means for policies. We are now in the purple tier. We remember this. This was the way we were for most of November and early December. Outdoor dining has come back online. Personal services, hair and nail salons are open. Hotels, motels, short-term lodging. Retails and malls are now able to open to greater indoor percent capacity of 25%. We're now able to regather in small social circles. Our social bubbles have reformed. They had burst at the stay-at-home order, but now we're able to gather outdoors with a 3 household maximum. Again, importantly, that's outdoors, maintaining physical distancing and covering our faces, particularly important as we come up on the Super Bowl and concerned that people may gather indoors, which would fuel more cases. Policies regarding schools are unchanged. They had not changed under the stay-at-home order, so they remain in the purple tier. Next, please. So now we'll get into the meat of tonight's conversation, and that is our COVID-19 pandemic vaccination response. Next, please. This is a new dashboard that we've just established on our website for the public to see our progress. And what this shows, this is updated daily. And this was from this morning. It may have been updated more recently. And every day we're seeing more vaccines. This is 23,953 vaccines administered to people who live in Marin County so far. That's over 20,000 individuals who are Marin County residents who have been vaccinated, which is about 8% of our population, which is significantly higher than the state average in terms of the percent of people that have been vaccinated in the county. On the light blue on the bottom there, you see the total of number of people that have had their first dose, and then the dark blue is those that have had their second dose. And it's about 10 days after that second dose where we really experience that full benefit of 95% plus protection and immunity. So this is obviously an encouraging sign that as each day passes, more and more of us are protected. Next, please. And then this shows by day, just like our epidemic curve, this is the number of people per day that have been vaccinated. And it shows that each day over the past, since we first started vaccinating those first doses on December 15th, we've vaccinated more and more on average. That dark line shows the trend. And it's now about 1,500 per day are being vaccinated in Marin County. And we vaccinate in pace with the supply that we receive. So every Wednesday, we at the county are eagerly awaiting to hear how many doses we will receive the following Monday, and immediately translate that number of doses into appointments at our points of dispensing, our pod sites that Jason Weber will talk more about. And the more we get, the more appointments we're able to make, and the more people we're able to vaccinate. Again, we are still dealing with very limited supplies relative to the demand. 1,500 per day sounds like a lot, but it really, relative to a population of 250,000, it's not enough for us to go beyond some very limited groups right now, which we'll describe later. Next, please. So now I'm going to hand it over to Chief Weber, who will describe our work in our points of dispensing. We invited and are just so fortunate to have partners in fire who know how to manage large-scale operations, mobilize large numbers of people to rapidly respond to emergencies. And this pandemic is in some ways like a fire. And we've been really fortunate that we have partners like Chief Weber and his entire crew to help us out. Thank you, Chief.
Thank you, Dr. Willis. And it's an honor to be a part of working with this team of dedicated healthcare professionals, the physicians, nurses, really that have been going at this for almost a year. I'm coming to this game a little bit later in the process. But as Dr. Willis mentioned, we're engaging the concepts we use in the fire service to expeditiously develop and deploy these points of dispensing so we can get everybody vaccinated. And a little bit about the nuts and bolts, how we're doing that. So we're approaching the development by getting direction from Dr. Willis, Dr. Evans, others you'll hear from tonight, that another pod needs to be established or a certain pod needs to be expanded in order to meet capacity and demand. It's really based on how much vaccine we're getting each week, and we're meeting that demand. First thing we do is we send an events planning team. So that team would go out, they look at a site, they develop a plan. Within 24 to 48 hours, they'll transition that plan over to an advanced implementation team. That advanced implementation team will build out the point of dispensing. So they'll take care of the logistical things. How many tables need to be set up, the lanes that need to be provided, the space that's required because we're in a pandemic and we still need to social distance. All of those things will be taken care of. They'll turn the keys over to the core team that will manage the pod daily operations from that point forward. So that core team will consist in the county pod at least, and every pod's a little different with the partnership we have with the hospital. But that core team will manage the pod daily. That allows us to maximize the use of volunteers such as the Marin Medical Reserve Corps, disaster service workers, other organized volunteers in order to eventually maximize the number of vaccines that we're able to distribute every day. We obviously couldn't do this with existing staff that we have. So to maximize that, these core teams can then really do on-the-job training daily with new volunteers. So the pods are scalable. The one at the Civic Center can ramp up to many thousand vaccines a day. Right now, as you heard from Dr. Willis, we're doing a little over 1,000 a day at that pod, but there's certainly capacity there once more vaccine arrives. And then as we expand out of that, we'll open a new pod at their direction. So that's kind of the nuts and bolts of how we're building out these pods. I'll talk a little bit about your experience as you arrive. So once you're invited to get your vaccine, you'll arrive at a vaccination center. There'll be a greeter there that one ensures that you're in the right spot, directs you to the process through the lines, etc. but also ensures that you're eligible. And as Dr. Willis mentioned, the limiting factor right now is the vaccine itself. And so your eligibility is important. You'll go through, next slide, please. You'll enter into the registration area. So this is the Marin Center pod. You can see that we've got lines set up so we can keep people socially distanced, but move rapidly through this. There's a set of tables you'll arrive at. You'll be directed to one of the registrants. You'll register because you already have an appointment. They'll confirm your arrival. You'll then proceed directly to the point of dispensing site. So next slide, please. This is where you'll actually receive the vaccine. So this is where paramedics, EMTs, nurses, doctors, as many as 25 some days, you'll walk into the room, you'll sit down next to them. We ask that you wear loose clothing so they can access your upper arms on each side. You'll receive the vaccination. From there, you'll proceed into a waiting room where we need to monitor your health for about 15 to 30 minutes, depending on if you've had any previous reactions or any medical conditions. Next slide. So before you go into this observation area, you'll go to a checkout station and they'll document that you've had your first or second dose. And then you'll wait in this area where, again, we have medical staff available if you do have any symptoms from the reactions from the vaccine, which are very rare. But we do have staff there that can assist you. So that's kind of the process from how we're building out the pods to once you arrive at a pod, what your experience will be. And again, these are scalable. This is a larger pod. Some pods may be smaller. And I'll turn it over to Dr. Evans, who will talk a little bit about the expansion of the pod locations, mobile pods, and everything pod related. So thanks for having me tonight.
Thanks, Chief Weber. And Chief Weber has actually volunteered over at our Marin Center pod, or what we sort of internally describe as our super pod. And I think what's really fantastic is the overall experience from the volunteer standpoint to the staffing standpoint, and then to the patient standpoint. I think there's a very, very positive, almost an emotional reaction to the vaccine process, and it's been great to be a part of that. Would you say that tracks, Chief Weber, with your experience?
Yeah, absolutely. I think everybody's interested in turning this around and being there, and there are hundreds of volunteers. Yeah.
Okay, so let's move on to the next slide. So basically, this has been our super pod, right? And at best, we've gotten to, our throughput has been 1,300 vaccinations per day. And most of that has been related to doses, the amount of supply that we've had on hand. Ultimately, our responsibility from a local health department standpoint is to get doses into arms as quickly as we possibly can, and to have as little on hand as we can at the end of the week, essentially. So that's our internal goal. So in order to do that, we are optimizing our sort of central operation at the superpod, but then we've also acknowledged that we need to have as many sort of access points as we possibly can, to ensure that we can maintain sort of components, feasibility and equity, and ensure that community is serviced in the most equitable, feasible, and responsible way. So our second pod has been constructed and is currently operational. We're going into the second week of that, and so that's at our Kerner campus around the Canal region, and it's Marin Community Clinics is our partner agency there, and we're looking to essentially provide access to folks living and accessing that area, because we understand that area essentially could have engages with communities that could be impacted a little bit more by social determinants, and I'll be describing that a little bit further. So partnering up with federally qualified health centers that really understand, communities that may struggle with access is incredibly important to get vaccines out to people that have a higher risk. Second is our Southern Marin pod, which is coming soon. So we're in the process of building that. And as Chief Weber had described, we have sort of 3 different phases of that sort of activation. We go from advanced planning to activation, and then to launch, and then sort of steady state. So that's going to be in partnership with Marin Health, and hoping to have that operational next week. And looks like that's probably going to be held at Redwood High, still a few moving parts on that, but that again should be operational next week. The final part in terms of this week's operation has been our mobile unit. So mobile unit also joined operations with the fire chief and his team. And our colleagues over at Kaiser and Marin Health. And so we're starting with, essentially long-term care facilities, and focusing on outbreak mitigation. And then as this progresses, we're going to be kind of mapping out different areas that have more vulnerable populations, higher risk of infection, and sort of populations that have issues with access. And bringing the mobile units is going to be either an ambulance or to that we are with, get the mobile units out of the communities, so that 6 to 7 pods within the next slide, please. So what groups are being vaccinated in Marin? So we are looking at healthcare workers. So that's phase 1A, and I'm sure we've spent some time with folks in this town hall before. So I'm sure many of you have heard our description of these phases. So I won't get too into the weeds with this, but we believe that we've almost completed our phase 1A. And just to kind of back up for a second, the CDC's advisory committee on immunization practices essentially describe these phases, provide a rubric for allocations across the nation, and then this is essentially picked up by state health departments, and the state health departments essentially interpret it to sort of track with the context of their populations that they're serving. And then local health departments kind of further interpret that and try to sort of prioritize different sort of populations within tiers and sort of sub phases. So there's phase 1A, 1B, 1C that's being described on a national level. Then there's tiers that are being described on a state level. So we have passed phase 1A. We are currently in phase 1B, although we're still vaccinating phase 1A healthcare workers who didn't, for whatever reason, weren't able to get in. So that door is still open, but we are in phase 1B, tier 1. And there was a little bit of confusion in the beginning in terms of folks that we were vaccinating, in terms of guidelines that were handed down by the state. But ultimately, we all kind of came together and said, look, what makes the most sense is age. Let's just do this based upon age, because in terms of primarily mortality, not so much the risk of infection, but what is the most important endpoint is to prevent deaths. And ultimately, what we found is across the state is that if we can prevent infection in those that are over 75 primarily, and just kind of work our way backwards, we would prevent the most death that we possibly could. So next slide, please. So that's where we're at, and we're receiving about 3,000 to 5,000 doses per week. Now we anticipate that that's going to that supply is going to be increasing over the course of the next month or two. There's a presidential administration change. There's the longer that we're going through this, the longer these vaccine companies have to increase sort of production. And then we also have 2 to 3 other companies whose product should be approved. We anticipate within the next 90 days. And so just kind of focusing a little bit more on the 75 and older, it's over 23,000 residents in Marin County alone. So, fairly sizable, population. So, based upon the doses that we've been receiving, but, also kind of expecting that dose supply is going to increase. We expect to get through this within the next 3 to 4 weeks. Next slide. And really, when we think again about these sort of age classifications, again, just preventing death, right? We wish we could prevent it all, and we will at one point, but at this point, we really got to get in there and prevent mortality. And I think particularly from a public health standpoint, that's what we're looking at. So we think this data is rather striking, and I'll just kind of unpack it a bit. But essentially, if folks are less than 50, they're 49 and below, and they're infected with COVID, the case fatality rate for these folks is 0.04%. That means in terms of folks that are infected, 0.04% of them will die. Once we get to, and this just keeps on increasing, as you can see this, once you get to 75 and older, in terms of folks that are infected with COVID that are 75 and above, nearly 15% of them, unfortunately, will pass away. So when we make sort of comparisons here, we find that more than that you're 300 times more likely to prevent a death if you vaccinate folks that are over 75 in comparison to those that are less than 50. So, I don't know about the other folks on this line, but that seemed pretty striking to us. And so, we feel pretty confident about our focus on the 75 and older, and that's what we're sticking with for now. But this will continue to, as our dose supplies continue to increase, we'll be able to get to 65 and older and then beyond. And then I'm just going to spend a minute just sort of talking about within that 75 and older, within these age ranges, there is variability. Next slide, please. And that variability is in terms of risk is really largely influenced by social determinants. And so, there's this web that, health research and social science research have really been sort of studying for decades and understanding how social determinants, how sort of necessarily non-biological precipitants essentially can determine folks' risk of disease and further sort of adverse consequences of disease progression. And so it's really, it's focused on, sort of race, gender, socioeconomic status, immigration status, et cetera. And we found that, these sort of demographic factors, impact, are involved in a sort of web-like interaction that ultimately leads to an aggregate sort of risk of adverse consequences. So we want to be mindful of that, and we want to try to do as much as we possibly can to sort of prevent that interaction from taking place. So we've really focused on our priority to provide protection to health equity, and Benita is going to talk a little bit more about how we've created a sort of roadmap to prioritize folks within the age strata. Next slide.
Thank you, Dr. Tyler Evans. I really appreciate your presentation. Yes, I'm Benita McLaren, Director of Health and Human Services. I just have a few brief slides here, and I just want to acknowledge that to the viewing public of Marin County, that here we are committed to ensuring access for all the residents of Marin County, and to make sure that especially our older adults who we're currently focused on, along with our healthcare workers, to get the vaccine, have the access that they need. We know that older adults can face barriers in this kind of event, and we are committed to ensuring that these barriers are reduced as much as possible. You will hear a little bit more later about some of our efforts to improve communication and improve information sharing through our public information officer. And also we want to make sure that you're aware that we are committed to looking at transportation barriers to ensure that we can respond to any needs for folks who may not have transportation. We're also looking at accessibility through many of our Health and Human Services programs and departments. We're also working with an access and functional needs task force to ensure that we don't miss any particular areas. And we're also really fortunate to have such a strong community-based organizations team here in Marin County who we're also working with on this issue. And as Chief Weber mentioned and Dr. Evans, our pod is really in this constant state of refinement and a constant state of improvement. And we're always looking to make sure that we can offer accessibility at our vaccine sites, including making sure we have wheelchairs and other supports available, seating for people who can't stand long periods of time, et cetera. Next slide, please. I want to mention that we are committed, as part of our commitment to transparency, we've started a community advisory board to help us throughout this vaccine distribution. We've recently completed our recruitment for the community advisory board. And this group represents different communities, peoples, and populations in Marin. And we'll have a vital communication, will be a vital communications resource for us. The purpose of the group is to help Marin Public Health connect with the different groups, peoples, and populations in our community to ensure access to the vaccine. And this includes helping us build confidence in the vaccine, as well as sharing communication about the vaccine, about vaccine safety and access. And I want to be clear that the state and federal government have already set the framework for vaccine prioritization, and we cannot change that. However, we believe the community advisory board can play a vital role and help us best reach out to all of Marin residents as they become eligible for the vaccine. Next slide, please. And then I just want to ask for all of our great Marin residents for your help. We know that this process is tedious. There's a lot of interest, which we're really grateful for. We're really grateful for the interest in the vaccine. But the vaccine phases were designated to ensure that we get vaccine first to those at highest risk. We're asking individuals to please be patient with us and to wait your turn. If you haven't been vaccinated yet, please find out what phase you're in, and please keep an eye on your phase for the vaccination. We're working really hard and as fast as we can to get everyone in Marin vaccinated, but it will take time to get to everyone. It will take us time. Realistically, it will take months for our entire county, our entire state, and our entire nation to beat COVID, but I believe we can beat it. And when we're done, we're going to be very pleased with the efforts that we've made. And now I'm going to turn it over to our PIO, Lainey Hendricks, who is going to continue with the information for this evening.
Thank you, Benita. I really appreciate that. You can go ahead and move to the next slide, please. So we've had a lot of questions from our public about knowing when they are eligible. And we've added a feature to our website that will make it very easy for you. If you visit our hub for vaccine information, which is coronavirus.marinhhs.org/vaccine, you'll see a section there called Quick Links. And that is a great collection of information for you to learn more about the vaccine, as well as what's happening here in Marin. On the top left button there, you'll see it says Vaccine Interest Form, and we encourage everyone to fill this out. This is one easy way to make sure that you are notified when you become eligible. It's a simple form to fill out. We ask a few questions just to help us assess what tier you might fit into, such as if you have any pre-existing health conditions, if there are any mobility or transportation concerns, similar to what Benita referenced in her presentation, age, race, language preferences, simple questions like that, and then you hit submit. As your turn comes up for eligibility, Marin Public Health will reach out to you at that time, let you know that you are eligible to receive the vaccine, and provide an overview of options as to where you can access the vaccine. So we're looking forward to engaging the group of people that have signed up thus far. It's close to 30,000 as those individuals not only are eligible, but most importantly, as there are appointment opportunities available to them, we will let them know. Next slide, please. Speaking of appointment options, the second button on that page is vaccine options. And this is a newer feature to our website, but is really crucial because we want to provide clarity to Marin County residents about where exactly vaccinations are happening here in Marin County. We know there's a lot of databases floating around on the internet. Many of them are not fully accurate. And so this is meant to be our one-stop resource of what's happening here in Marin. And it will continue to be updated frequently as more providers come online. So currently it outlines options for Kaiser Permanente members, Sutter Health members, Marin Health Medical Network members, as well as other commercial or outside network options, such as One Medical and our commercial pharmacies. It lists who's offering vaccine, who are they currently vaccinating, and how to make an appointment. And so that will be a helpful resource to all of you as you become eligible to receive the vaccine here in the near future. And next slide. And finally, I want to share with you a special opportunity to help inform our response as well. I know Benita talked about the Community Advisory Board, which is set, but there's still an opportunity to help us, and that is to participate in our perception survey. We're conducting a survey about the perceptions of the vaccine itself, and to help us assess the prevalence of vaccine refusal and hesitancy, those reasons for hesitancy, and for those that are open to the vaccine, reasons for why they chose to be vaccinated. And really, we want to hear from our community to understand what groups might have concerns, what those concerns are, so that we can provide a wealth of information to help them make an informed decision about whether or not to be vaccinated for COVID-19. So with that, I want to just make one last plug for our website, coronavirus.marinhhs.org/vaccine. Surf on over there when you can and check out all the information resources that we've made available to you. And with that, I'm going to turn it over to our wonderful panelists from Kaiser Permanente San Rafael. We have had a number of questions in the last week about variants and other clinical matters as it relates to the vaccine. And you truly have some of the top experts in Marin County here, not only familiar with the vaccine, but also on the front lines of the COVID-19 pandemic fight. And so with that, I'm going to turn it on over to our team at Kaiser to take us the rest of the way.
Thank you, Lainey. Can you confirm that you can hear me?
Yes, we can hear you.
Great. Hi, everyone. I'm Dr. Shilpa Marva, an infectious disease physician, and I'm going to be talking about the SARS-CoV-2 variants. Next slide, please. So we know that viruses constantly change through mutation, and we expect new variants of a virus to develop over time. SARS-CoV-2, which is the virus that causes COVID-19, is no different, and multiple variants of this virus have been documented in the US and globally during this pandemic. I will be talking about two variants which have gained some interest in the media lately. Next slide, please. The first variant that I will be talking about is the B.1.1.7 variant, also called the UK variant. It was first identified in the United Kingdom in September 2020. And it was probably detected first in Britain just because they have a very robust virus genetic analysis and sequencing system in place. This variant spreads more easily and quickly than other variants, so it is clinically significant. And currently, there is no evidence that it causes more severe illness or increased risk of death. It is highly prevalent in London and the southeastern parts of England, but has now really been detected in most countries of the world, including here in the United States as well as Canada. Next slide, please. The L452R variant is the variant that has been getting a lot of press coverage recently, and this is because it was identified in California in late 2020. It has since also been identified in several other states and countries. The frequency has been increasing, and this has been seen in several large outbreaks in Santa Clara County, including the large outbreak in San Jose in late December 2020. Scientists continue to study this variant further to see if it is more infectious or if it affects vaccine performance. But at this time, there is no evidence that this variant will decrease either the effectiveness of our vaccine or the infection control practices that we recommend. We do not know yet if this virus causes the disease to be more severe or it causes the disease to become more transmissible, or if it will affect its treatment. But again, this is an evolving situation and more information will be available about this variant. Next slide, please. So again, really, this brings up the question of what does all of this mean in terms of our recommendations for vaccination and infection prevention. And again, a reminder that COVID-19 is an evolving situation. So while new information may become available in the future, at the current time, there is no evidence to show that vaccine effectiveness is decreased due to the presence of these variants. Vaccination, along with masking and social distancing, will slow the spread of the virus. And these measures will help prevent further mutations from accumulating, because once you slow down the burden of the disease, the ability of the virus to mutate reduces. Next slide, please. I believe this is my last slide, which sort of brings everything together. And essentially the recommendation here is that all the previous practices of infection prevention and control continue to be effective and are important to continue. So again, stay home except for essential activities, limit unnecessary travel, wear a good mask when in public or around other people, limit interactions outside of your immediate household, physical distancing, washing hands frequently, and getting the vaccine, which is another tool in our armamentarium, but does not replace infection prevention practices. And with that, I'm going to pause and we will be around for questions as they come up.
And I think with that, we're going to transition back to Dr. Willis to add some closing comments before we open it up for Q&A.
Great.
Next slide,
Thank
please.
you. Thank you, Dr. Marwa. I think the community gets a sense of what an asset of expertise we have right here in Marin County. And I have a personal gratitude to Dr. Marwa and the team for helping me through my experience as Marin County's 39th case of COVID-19 back in March. So thank you. Next slide, please. So, let's just take a step back and think about what all this means 1 month from now. You heard from Dr. Evans and others who have been at the vaccination sites, just the excitement and encouragement and inspiration that our clinicians and others who are part of those operations feel when they're actually vaccinating people. 1 month from now, we can expect this. Our healthcare workforce will essentially be almost fully vaccinated and will be protected for their work as they take care of people who come in with COVID-19. Total game changer compared to the fear that we've had on their behalf and that they've experienced thus far. Most at the highest risk of death in Marin County will be protected. If we're able to maintain vaccination rates of over 1,000 per day, and we're focusing on that most vulnerable, oldest members of our community, our mortality rates will begin to decline significantly as early as 3 weeks from now. We can also hope to have a clear federal plan and more doses from the state. We are vaccinating more groups. A month from now, we'll be able to be vaccinating more groups, more age groups, bringing in people who are eligible by virtue of occupation. There'll be more locations to obtain vaccines. The pharmacies will have more points of dispensing, as Jason explained. They'll be getting vaccinated in more and more healthcare settings. So this is the beginning of a process that's going to continue to grow. And at each stage, in fact, at every day, we're getting more and more protection. Next slide, please. So in summary, our case rates are declining, where our third surge is resolving. The stay-at-home order has been lifted. We're in the purple tier. Vaccine distribution is well underway. The supply really determines the rate that we're able to move. We're focusing on healthcare providers in age 75 and older. Everyone in Marin County will be offered the vaccine. Our work right now is to prevent a fourth surge. We are at risk of a potential fourth surge if we let down our guard. This is not a sign, lifting the stay-at-home order is not a sign that the coast is clear. In fact, as Dr. Marwa mentioned, with the variants, there may be risk of strains that are increased infectivity, and we need to be even more on our A game in terms of socially distancing, covering our faces, not gathering indoors. Concerned about the Super Bowl coming up again. Next, please. And this was my experience earlier this week as we were starting that second pod that Tyler mentioned here at the Kerner campus in the Canal, obviously a community that was very hard hit by this pandemic. Now that community starting to get vaccinated. And this was as our Department of Public Works was coming to set up that pod site. This is what emerged on that rainy day, and it speaks for itself in terms of the hope that this represents for all of us. Next, please. And I think that completes our presentation. And we're ready for questions and answers.
All right. Thank you, panelists, for this really informative presentation. And I can tell you we're seeing comments on Facebook of thanks for the detailed explanation of the various pieces of your presentation. So I want to thank you again for providing that overview. We have received close to probably well over 150 questions. We will not be able to get to all of them, but I will dive into some of the more common themes that we're seeing here now. So have some questions at first for our Kaiser team. Since you are vaccine experts, have you seen any bad reactions to the vaccine thus far?
So I'll take that. I'm Laura Eberhard. We have had modest vaccinations. We've all been through the vaccine, so you've got a lot of experience here in the room on what it's like. Mild arm pain with the first shot and a little bit of flu-like symptoms with the second shot, and that to us made us all feel better that it was working, that it was activating our immune system. So even though we didn't totally feel so hot at work the next day, after that second vaccine, we felt very satisfied that we could feel ourselves having an immune response. In terms of serious adverse effects, we've had, out of the 6,000 or 7,000 vaccines that we've given, we've had less than 5 go to the ER. We've had no anaphylaxis reactions. We are totally prepared for that, but thankfully we have not had any reactions like that.
That's really good to hear. And in our questions, it appears we do have a pretty good turnout of Kaiser patients here asking questions. And so there's some questions around clarity of who is Kaiser vaccinating right now, because it seems like Kaiser and other counties are sending different messages. So if you could clarify that for the Marin County community, I think that would be helpful.
Absolutely. So we're still doing the last of phase 1A, which are the healthcare workers, both KP healthcare workers and non-Kaiser healthcare workers. We are doing both those groups. That group is very much dwindling. I think most of those folks have been vaccinated either by us or by the county. And we're doing the patients 75 or older. There was a brief window right around January 14th where the state decided that everybody 65 and older should be offered the vaccine, which our hearts totally agreed with, but our phone lines couldn't quite grapple with. There was a large bolus of folks that were able to get through and get appointments, and we are honoring those because that feels important to do when people made those appointments in good faith. So there are some people right now between the ages of 65 and 74 who do have appointments based on that, maybe 3 days of open appointments for that. Right now, we've really narrowed down to the 75 and older group and keeping in lockstep with our partners at Public Health in terms of trying to not be confusing for our county and stick with the same tiers and phases. Oh, I'm being reminded we are also have been leaning very strongly into our skilled nursing facilities and our residential care facilities for the elderly and other group living areas. So we really are very strongly making sure that both their staff and their residents are vaccinated.
That's
And
great news.
Sorry, Lane, I just wanted to add that, it's as Dr. Everhart had mentioned, it's so important that, that the clinical partners are really kind of synchronized in this effort. And we just really, so much appreciate. I don't think this is, exactly the case throughout, certainly throughout all of California. So I think it really speaks to our spirit of collaboration here in the county for us to really kind of be working together. And that, there's so much confusion to the community. Where am I? I'm looking through the chat here. I know a lot of folks are confused. Where am I? I got a call. I heard this. I heard that. And so we really want to just kind of clean that up as much as we possibly can, and just again kind of focus, age and I think some of the slides that we had, I think it sort of speaks to the reason why we're focusing on these age groups.
Thanks for that, Dr. Evans. I'm going to pivot now over to vaccine supply, which I know you addressed a bit in your earlier remarks, Dr. Evans, but a repeated question that we're receiving is, how is it that other California counties seem to have a much, much larger vaccine supply and what Marin receives is next to nothing?
It's a great question. So it's largely based on it really depends on the phase that we're in, right? So when we were in phase 1A, which was, healthcare workers, it was based upon the number of healthcare workers in that county, which the state, with some degree of confidence has at their sort of, they have access to that. So they essentially calculated that and then allocated proportionally across the state, based upon that number. Once you're getting to phase 1B and beyond, which, includes larger members of the community at large, they, are looking to proportionally kind of send out, based upon the size of folks, the number of people living in that county. So Marin, County is a, medium-sized county, so we're not obviously going to get the supply that Alameda County or LA County certainly is going to get. But at the same time, from an age-based standpoint, our 75 and older is such a large population. It's close to 24,000, which is roughly 10% of our population. It's proportionally we're actually getting more than other counties, if that makes sense.
That helps. And a related question about supply is, how do you make sure you have enough for second doses?
Right. So that's a great question. First and second doses, there's been a lot of confusion, and I'll just kind of make this as simple as I possibly can. So there were a lot of questions about, do we just scrap the second dose for now? First dose, could that provide enough sort of protection for a while? It's interesting. A lot of folks talked about it. There might be some theoretical opportunities there. A scientific advisory committee essentially, met, convened, discussed it, and ultimately said, you know what, we really got to stick to the science. So we're going to stick to the 2-dose regimen right now for Moderna and Pfizer. For other vaccines that come out, that they are single only doses, so we don't have to worry about that. So how does that sort of impact our allocations? We know that from based upon immunological principles, that second dose does not exactly have to be on the 21 days or 28 days based upon the Pfizer Moderna schedule respectively. we want to get as close to that as we possibly can, but it does not exactly have to be on that. And frankly, if you get a little bit beyond that date, it's probably fine. CDC has just provided further clarity that if you get the second dose roughly 42 days or 6 weeks after the first dose, you're in good shape. So a lot of these allocations, we're not necessarily sort of dividing up between first and second doses. We're essentially just kind of, you know, getting all of them, trying to schedule as many folks as possible, but still our team is tracking folks that we have vaccinated, you know, in the past and allowing those second dose appointments to come online. So while the state is not making it very, you know, clear in terms of that sort of division, we are doing our best to kind of keep track. But just,
right.
I guess, yeah, just the last point is, if folks, we're getting a lot of questions about, you know, I haven't got an appointment. It's, you know, I'm at my 21 days or 28 days. And I guess, you know, the important point to really socialize is, you know, don't worry too much if you're kind of getting close to that, you know, to that date. You've got a little bit of time, so we'll get to you.
Great. Thank you for that clarification. I'm going to pivot on over to Benita McLaren, who I think is still with us. I know she had to cut to another meeting. Oh, good. You're still here. We've had a couple of questions about the piece that you brought up. And considering, you know, your work with the Community Advisory Board, as you mentioned, you know, what are some of the, what social impacts of COVID-19 are most concerning to you besides just the infections?
Yeah, I think it's a really important question, Lainey. Thank you for asking that question. Because I'm oversee Health and Human Services, I can tell you that we've seen some devastation, not only on our health, from a health point of view, but also from a social point of view. People losing their jobs, people at risk for losing their homes or who have lost their homes, increase in homelessness. We've definitely seen some major impacts on mental health, and unfortunately some increases in opioid use, overdoses, and even suicide. So it's really critical that we do everything in our power to eradicate COVID-19. And we need everyone to please take the vaccine when you get your chance. Thank you.
That's helpful. Let's see, we have a few more questions about the, let me see here. Actually, we have a few questions for Chief Weber. Wondering if all of your paramedics have been vaccinated. Well, I guess we've already had Kaiser talk about the reactions, but I mean, just, I guess, looking for validation what the side effects are like. So can you talk about the experience from your department standpoint?
Yeah, as the doctors from Kaiser spoke to, minimal impacts after, and I think the benefit is they're out on the front lines, they're working in the vaccine distribution centers, and that level of protection, certainly from somebody who cares deeply about them, feels great, and I think their response was perfect.
Perfect. And I'm actually going to pause for a moment because we are running a little bit over time, but because our panel presentation went long, we're going to try to extend this a little bit longer, but out of respect to our wonderful language access team, I want to pause and just verify if our closed captioner has an ability to stay maybe 10 to 15 minutes longer.
Yes, I'm able to.
Wonderful. Okay. With that, we're going to dive back into questions. And I just also want to pause and thank the wonderful professionals that are providing language assistance this evening. We have our awesome ASL interpreters, closed captioners, CART captioners, as well as Spanish interpretation. So thank you all for your service here this evening as well. Okay, so we have a number of questions about the pod and access, and wondering for those that are in that 75 and older age group, some of the accommodations that might be made available to them. So for instance, there's questions about, what if I'm not able to stand for long periods of time and things like that. Dr. Willis, do you, or actually I know Benita is still here, thankfully. I know I'm going to be respectful of your time as well. Perhaps, Benita, you can speak to some of the work that's happening there at the pod. You mentioned some, but maybe you can elaborate on that.
Yes, I want to give credit to our Access and Functional Needs Committee to have identified some things that are point of dispensing or point of dispensing center at the pod. They have identified the need and have been able to locate additional wheelchairs so that we can increase the ability for folks to move around. They're very cognizant at the pods of making sure to ask our clients that come to the pod if they need additional support, because sometimes they do have to stand for long periods. And if they have to stand, that we do have chairs available and ways to help people access more comfortably. So it definitely is one of our goals to make sure that we provide any access that we can. And if there are other things that we need, we have interpreters on site. Any other access needs, please bring them to our attention if you come to the pod. We're definitely looking for ways to make sure the experience is as best as possible.
Thank you for that. Dr. Willis, here's a question for you. I am a resident of Marin County, but my doctors are all located at UCSF in San Francisco. Can I still be vaccinated in Marin, or do I need to wait for my doctors in San Francisco to engage the vaccination appointment process?
Yes, that partly or mostly depends on your criteria for being vaccinated. If you're being vaccinated based on your occupation, you'll get vaccinated in the county in which you work. If you're being vaccinated based on other factors like your age or medical condition, you're vaccinated in the county in which you live. That's the general response. However, having said that, if you are offered a vaccine anywhere, I would take an opportunistic response and go ahead and take advantage of that vaccine that's being offered to you.
Okay. And Dr. Willis, while I have you here, do you have any, and actually I guess this could be for either of you, do you have a forecast of when you think we might reach the point of opening up vaccinations to the 65 to 74-year-old group, recognizing it is dependent on supply?
Yeah, well, so we're obviously taking a very clear age-based framework now, 75 plus. The next would logically be 65 to 74. We have 23,000 residents above age 75 in Marin. We have about 33,000 residents who are between 65 and 74. So that decade is actually even a much larger group. And that will be the next group to come online. So depending on our dosage, the amount of doses we receive will really dictate how quickly we're able to move through these 20,000 remaining seniors above age 75. And as soon as we get through that group, then we will move together, hopefully, to 65 to 74. The question that is still remains to be answered partly by guidance from the state is what other groups will come online with that new age cohort. Will we then start offering vaccine to some of our other tier 1 essential workers, teachers, food service workers, agricultural workers, et cetera, may be incorporated with that other age cohort, depending on state guidance at that time.
That's helpful.
So Lainey, just to add a number to that, because that, everyone always wants a number. So we're in terms of our allocations, our average is probably about 3,500 to 4,000 doses per week. And now some of those are going to be second doses, so it's hard to say, but you could just folks can do the math. If there's 23,000 75 and older, we've had about a week to get through the sort of first round. So if it stayed the same for first doses, it would be roughly 4 to 5 weeks, but then we also have the second doses. So it becomes sort of a complex game of arithmetic. And then also, I think we would like to start the 65 and older we can kind of, almost do the way that I describe it, kind of like a Southwest Airlines sort of boarding, pass. Folks are still kind of boarding, but other folks can start sort of boarding as this other group is on the plane. So I would say probably sometime within the next 4 weeks, but anything can change.
That's encouraging. Great to hear. I'm seeing a number of repeated questions about verifying proof of age and residency, and I actually have the answer for that one. When you go to a Marin Public Health site, as well as some other sites as well, not outside of a medical network, so not necessarily Kaiser or Sutter Health, you will be required to prove that you are over the age of 75 and older, and that you're a resident of Marin County. So bring that photo ID, whether that's a driver's license, a passport, or some other photo ID. And as far as a proof of residence, if your photo ID doesn't list your residence address on there, consider something like your utility bill in your name, maybe your vehicle registration. If you have your voter registration confirmation, there's a number of documents that would, as long as it has your name and your address, and again, you have that photo ID to accompany it, that's the kind of proof that they are looking for at these testing sites. So I'm going to turn back to our Kaiser docs because we've had a few more questions about the safety of vaccine. You all have been wonderful to let us know that there's been minimal effects from the vaccine, but we have a few specific questions about if someone has had anaphylactic shock from penicillin specifically. In those situations, should they be concerned about getting the vaccine?
Yeah, happy to answer that question. So having an anaphylactic reaction to penicillin or any other medication is not a contraindication to getting the COVID vaccine. However, if you let your vaccination team know about the history, you will be monitored for an extra period of time. So everyone who gets the COVID vaccine gets monitored for 15 minutes. People with a reported history of anaphylaxis get monitored for an additional 15 minutes, making it a total of 30 minutes, just to make sure no untoward reaction happens. And again, every vaccination site is equipped to deal with anaphylaxis in line with CDC recommendations.
It's helpful. Thank you. Benita, I think you are still with us. We have a few questions that are specifically about our, obviously the older adult community that we are currently vaccinating, and concern, wondering how we might be reaching out to those that are not as digital literate, do not have a level of digital literacy as maybe some of the other younger audiences may have.
Yes, we, as I mentioned, we're really working with our community-based organizations and doing our best to look at any kind of way possible to communicate with these, with all of our older adult populations. I think our biggest opportunity is through our community-based organizations, as well as media and social media. We are going to have available, in addition to the website, a phone number. You can call now to just get general information at the 473-7191 number, 415-473-7191. You can get general information, but we will later provide a phone number where anyone who doesn't have commuter access can make appointments. You cannot make appointments on that line right now, but we will, we're working on that ability to create more access. So yes, we are trying to make sure that we have access for everyone, especially even those who don't have a computer or internet access.
Lainey, can I just add something to that? As we've been talking about building out these phone banks, part of the way that we roll in Marin County is that everyone has been so eager to help in this response. We've seen it across our medical community, our first responders, our educators. And so we have literally throngs of volunteers who want to help out. And that's a great role for volunteers, to be able to sign people up, have that tech skill to be able to just schedule an appointment based on a phone call, to actually give someone that time. And that's, I think, one of our hopes is that our collective experience of this pandemic, the legacy for this community will be where we came together to respond. We are one of the most successful counties in terms of reducing transmission. We have some of the lowest rates. And I think we are also one of the most successful in a collaborative response. So our pods that you saw are largely volunteers. Clinicians and others are volunteering for them. And this is another way in which volunteerism is going to help us reach everyone, is our volunteers stepping forward to help those that need a little bit of extra help to get vaccinated. And manning the phone, the phone bank is just one example of that.
Excellent. Thanks for that extra point. Another frequent question, also low-hanging fruit, so I'll take this one, is once we sign up and we are eligible to be contacted for the vaccine, will we be given a time and a place to get vaccination, or do we just have to actively find our own options? When you fill out that interest form, we also ask who your medical provider may be, whether that be Kaiser, Sutter, Marin Health, or other. And the idea there is when we contact you, we are planning on trying to provide you information that your medical provider would want you to have. They're also providing you that information, but to cover the bases, directing you to that medical network if you're a member of that. We also are going to be providing alternative options either through Marin Public Health or through our commercial pharmacies as they come online and so on and so forth. So it's not a matter of just, hey, you're eligible, good luck. It is a matter of, hey, you are now eligible and here are the options that are available at this time. Do keep in mind that if you are notified, it doesn't necessarily mean we have adequate supply to vaccinate everyone in that group at one time. So when you were first notified, you may not have an appointment available to you right away, but that you are eligible to make an appointment and that in the coming weeks of that eligibility, you should be able to get an appointment. All right, and then one last question, because I know we are running out of time. We've had a couple questions, interestingly enough, about if where you receive your first vaccine, if you must return to that location to get your second vaccine. I'm not sure if maybe this is a healthcare worker that was vaccinated outside of the county or maybe somebody that moved into Marin County recently. But is that a concern? And Dr. Willis, do you want to address that if there's any importance of sticking to the same location?
Yes, ideally you should stick with the same provider, just because that's a way to ensure that the timing is correct, that the vaccine itself is correct. We don't want to mix doses, so you don't want to start with Moderna on number 1 and Pfizer on number 2 or vice versa. So you stick with the same one, and the best way to ensure that you're actually completely vaccinated is to really stick with where you first got vaccinated, and that should be part of the process on your first dose, is really having established that second dose, either a visit or a process for obtaining that second visit.
All right, thanks for that. And to all of you that submitted questions that we did not have time for, I do want to thank you for submitting these. We have a robust FAQ on our website, and what we'll do is share these with our public information team to help inform additional questions that we can add to that frequently asked questions section. So thank you, and keep an eye out for that section to be updated so that you can find answers to your questions. So before I close, I want to give a really, really big thank you to our really big panel that we had this evening. Dr. Matt Willis, our Public Health Officer, Chief Jason Weber with Marin County Fire Department, Dr. Tyler Evans, a Deputy Public Health Officer and Branch Chief of Vaccine in our Emergency Operations Center, Benita McLaren, Director of Health and Human Services, Dr. Naveen Kumar, Physician-in-Chief with Kaiser San Rafael, Dr. Sharipa Marwa, who is the Chief of Infectious Diseases, Dr. Laura Eberhard, Chief of Intensive Care, and back there somewhere is Pat Kendall, Medical Group Administrator. They are all with Kaiser San Rafael. And we really appreciate you making time to answer these important questions this evening. Before we close, I want to remind you that you can find the latest information about COVID activity in Marin, vaccine information, public health guidelines, school reopenings, testing information, and more by visiting coronavirus.marinhhs.org. You can also sign up to receive our daily status updates, which provide an update on vaccine progress, as well as confirmed case data and other updates. You can subscribe to those by going to coronavirus.marinhhs.org/subscribe, or to receive the updates by text message, text the phrase Marin COVID to 468-311. And if you had a question that was not answered during today's event, remember to check out that FAQ in the coming days. And remember, we do have our COVID-19 response team. You can contact them using the contact button on our website. Well, that is all for this evening. Again, thank you to our panelists, and thank you all of you that tuned in and watched. I think we had close to 1,000 viewers. This is recorded and will be posted on our YouTube page tomorrow, so look for it then. Other than that, stay safe, everyone. Thank you for watching, and we'll see you again very soon. Good night, everyone.